Well, when COVID-only recovery centers opened in the spring, the state was worried that hospitals would be overrun, so their mission was only to free up hospital beds by moving people who needed an intermediate level of care here. But now the state will also be accepting COVID patients from long-term care facilities. With COVID cases in long-term care facilities on the rise, the COVID-only facility known as Westfield Meriden will reopen by November 16th.
Initially, we'll be able to accommodate up to 90 residents, and then as time goes on, we could grow that as well.
Athena Healthcare stepped up as the only operator willing to manage these facilities for Connecticut. Now it's being hailed as a model for other states to adopt.
I have gotten the feedback that Connecticut had been identified as a best practice state.
Fox 61 obtained a copy of Athena Healthcare's review of operations. It shows 90% of the patients at their 4 COVID-only centers recovered, compared to 25% in traditional nursing homes. The report also found PPE could be preserved more easily here. Athena is urging the state to identify more vacant buildings to serve as COVID-only facilities.
We're hoping that by opening up Westfield 30 beds at a time, that would be able to accommodate the current needs of the state. If those needs change over time, there are other locations across the state that could be opened up fairly quickly as well.
Athena Healthcare has made it clear they are not willing to convert their existing nursing homes into COVID-only facilities. They did this in the spring with both Sharon and Northbridge and had to find new homes for more than 100 elderly residents there who did not have the virus.
The trauma for the residents, families, and staff associated with using an existing center requiring the transfer of the residents out of the building was just too much to bear on them and, again, our staff.
Reporting in Meriden, Matt Caron, Fox 61 News.